how we got there that I think maybe the press release didn't hit exactly. Because this is around medical, I can't talk a whole lot about that, but I'll talk generically and maybe talk in hypotheticals. If you ask me a question that I can't really answer, talk more generically about what we would do in situations with different inmates, and have we ever been in this situation before, those types of things, I'm happy to answer. So do you want me to go over the details of this thing, or do you want to just ask your questions? I'm
open to start out whatever you would want to say.
Okay. So the case starts with an investigation down in Springwater. This subject's accused of sexual crimes, again, common occurrence, a general arrest. The investigators bring him into the jail. He's processed in on the 4th, that was the arrest date, and by the 5th, the next day in jail, he has a medical event, which then takes him out to the hospital. That's common occurrence. I mean, we deal with that quite often with a population as large as ours. So the next several days is really not that much different of any other case. It's actually exactly what we would do is you have a deputy at the hospital because they're in the custody of the sheriff by court order. So anytime a judge orders someone in the custody of the sheriff, the subject is in the custody and the care of us. So whether they're at the jail, medical appointment, hospital, they are not ever out of our custody. So this subject was in our custody up until the 12th. Let me verify that. Just want to make sure I got that right. The 12th. On the in-between of the 5th and the 12th, we're providing 24/7 coverage at the hospital. So what happens in cases like this? It comes down to decisions, and you're looking at the financial aspects of having a deputy at the hospital around the clock. You're looking at what is the medical history, what's the medical future, what does it look like for the family, medical records, all the barrage of different things that go into this case by case. With this particular one, the decision was made to talk to the DA's office, to talk to the court, through cooperation of the public defender's office to see if they would be willing to grant a release, similar to like a furlough. We want the subject on these charges, but if this is a long-term event, it's not fiscally responsible given the details of what we had at the time that we believed. And so the court agreed to that and did do a release based on revisiting the medical information minimally on a week-to-week basis. And so the subject was out of our custody. The short window then, the next day, we are then told that the subject is no longer at the hospital, which that probably surprises you. It surprised me as well. And so then it's our job to say, hey, this guy has significant charges. We didn't anticipate this. Nobody did, and we want him. So then our folks respond to the hospital in conjunction with Rochester Police Department, et cetera, and ultimately we then get him into our custody because the judge had since changed the court order again in cooperation with the DA's office, knowing that we want him in our custody. So that's the 80,000 foot view. If you have specific questions, I'm happy to try and answer them. And just so you know, this is Chief Deputy Aaron Galvin. He leads our Correctional Services Bureau, which covers the jail. This is Chief Deputy Dan Rittenhouse, leads our police services, which leads both patrol and CID. And this is Captain Mike Williams, who leads our CID.
Is this a whole misunderstanding? If he had these felony charges, it sounds like he wasn't supposed to be released from the hospital, or did someone mess up here?
No, I mean, here's the thing. The hospital, they know when we have a hold on somebody, but there's times that people come out of the hospital, whether they walk out unknowingly. Sometimes the hospital, if they don't have paperwork, won't hold. There was no custody to the sheriff because we had requested that to be changed based on what information we had at the time. Again, I think the biggest one on this case is when I heard that the subject had changed in such a dramatic fashion to the point where now he is either in the hospital walking out or already away from the hospital, it made no logical common sense based on what the medical event as described to us was. But again, things do change, and In this case, it changed rapidly. Again, it's the next day after this. If I thought it was going to be a week or 2 weeks, the decision probably would have left deputies right there at the hospital around the clock, even though that's very costly to our taxpayers. So this is one of those ones that's an anomaly.
Was the hospital supposed to,
Go ahead.
was the hospital supposed to keep you aware of his status, or was that really not their responsibility?
Yeah, I mean, we do request the hospital to share with us the information, like if something significant changes or if they're going to be released, and let them know we want them. But again, I'm not placing blame on the hospital. I don't know what their policy is, if they would actually physically hold them, or if they would only do that if there was a warrant. I don't want to speak for the hospital, and I'm not blaming anybody. I own this one as the sheriff. I made the decision based on what I had, and if I knew it was going to change 24 hours later, it would have been a different decision.
Sheriff, in terms of the way in which the custody was removed, as it was mentioned in the press release, with the stipulations of continual checks, are you able to expand any more on that? Was there any type of check system in place, like that there would be a type of regular check-in? And at what point, mornings, nights, like how did that look, if you're able to expand on that?
Yeah, it was described as a weekly check-in. But with us here, we're constantly calling the hospital to get updates. And again, I can't speak to the exact medical event, because that would be a violation of everyone's favorite word, HIPAA. So I will just say in a very generic term, if we had a similar case with a serious medical event that put someone into a serious medical situation at that current time, we would still, regardless of if we asked for the release and it was granted, we would still be checking in with the hospital to ensure that that person was, one, still there, and that nothing significant had changed. This just changed so rapidly that I think you kind of had a perfect storm here. But again, it goes to show that you can't predict everything that happens, and we learn that. And most times we get it right. In this one, the medical changed very, very fast.
And is this something, clearly, it's a shock to the community as well, but is this something that's typical, where an instance happens where an inmate has a situation that rises to the level of warranting hospitalization, and in terms of staffing, being able to manage that, is this something that happens?
Yeah, I mean, you take larger jails, they probably have a full-time unit that just sits on hospital details. We don't, so we cover it with either part-timers or overtime. And again, it does get costly, but it's part of the operations. It's part of doing business. The difference with this one was, based on all the information we had, we didn't believe that this was going to change this quickly. It looked like a very long-term situation that ended up being a very short-term situation. So that one's, again, different from some, but the predictability, we're taking all the different factors and making the best decision we can. And the second point is this. I know some people deemed it an escape. It never was an escape. He's not being charged with an escape. He wasn't in our custody, so that charge wouldn't fit. Did we have the option to do nothing? Sure. I mean, he had been arrested, he had been arraigned, and he had been released. So could we have not gone and searched for him like as timely as we did? Sure. I mean, we absolutely could have said, hey, you know what, tomorrow, the next day, a week from now, he'll turn up. He's been charged. We know where he lives. Sure. But I think we always jump on things very aggressively, especially if you're talking about felony sex charges where we don't want them out wandering around. Again, we would have kept deputies there at the hospital if we felt that this was going to be this quick of a turnaround. But when it does change this quick, I feel like we have that responsibility as sheriff to our community. And yes, this was occurring in Monroe County, but still to that community to grab them back up and say, hey, you're coming back to jail by order of the court.
And as a quick follow-up as well, who conducts the a medical diagnosis? Would this be the infirmary within the jail? How does that get evaluated?
That one's case by case. I mean, we do have our own medical here. And again, I can't speak specifically to this case. Sometimes I will say this: there's medical in the jail, there's hospital, and sometimes it's a conglomerate of both having discussions.
Was he released, or did he just walk out of the hospital?
I'm not going to speak on behalf of the hospital. That'd be a question for them. All I can tell you is he was released from the court, not in our custody, from April 12th until we got him back into custody after he was gone from the hospital, and he was picked up at a house in the city.
Yeah, I believe on J Street. Do you know? No, but anyways, what led to be able to find him, where he was at? Was there information that you knew, somebody you knew, or?
I think the two biggest things of how we got him so quickly was good partnerships that we have with law enforcement in Monroe County. Whenever you got that going on, you get a lot of teamwork and things always work out well. And communication. There was communication both within those partnerships and externally from the community that helped us. And so
Go ahead.
I'm not going to get in the details exactly how we got them, but I will say that partnerships and communication and both within the law enforcement community and the Monroe County residents helped us out.
Can you confirm if it was mental health or physical?
I can't.
So he's back in your custody now, so is his medical condition okay, can you say now?
I'm not going to get into his condition, again, just because the medical stuff is so protected.
You don't see any more visits in the foreseeable future, or can you not say?
I can't say.
Did someone at the hospital report he was missing? How was it learned that he left the hospital?
Captain, was that the hospital or us or?
The hospital contacted somebody from our agency, and that's how we found them.
So they contacted you afterward, they didn't let you know before?
The first information we got was that he was away from the hospital. It might be still within the hospital, but they couldn't say like he's in room 204. So it was, hey, where is this guy now type situation, and let's get him back into custody. It was a call to the court to say, hey, we've had a significant change here. We want the court order changed, that we want him back in custody, and then you have to work with the court to then have a new order that says he's back ordered to the custody of sheriff, and then go find him.
How easy is that process?
I think I think any process has got different challenges to it. But again, we got a great team here within the sheriff's office, and they all rise to the challenge. It doesn't matter what time of day, and early morning hours is back in custody.
In terms of this person, who has been charged, and is he known to law enforcement? Is this something that is a common occurrence, or is this based on that?
Do you mean the charges, or
The
do you mean
felony
like
charges.
this incident, like he does this?
The felony charge is just is this something where he's had?
He's not familiar to me.
Prior convictions?
I'm not sure if he had prior convictions. Do you know, Captain?
Yes, he has some prior convictions. He's not originally from this area, and moved down to this area probably about 1 year ago.
Where is he
Not
from?
very familiar to us.
Do you know where he's from?
The Monroe County area.
Are those related to sexual abuse of a minor?
The prior charges,
Yeah.
I can't answer that right now.
And in the initial release regarding this incident at Strong, it was mentioned that was an update from the original release from the first week. In terms of any concerns for the public, of course, there was social media chatter. In terms of and it was you just mentioned the severity of the charges, what he's been facing. Was there any concern for the public at that point, and just how come there was no official word that night on Sunday?
Do you mean like, was there concern between the time that we were notified he wasn't in the hospital or
Yes.
an exact location in the hospital, and when we got him into custody, was there concern
Correct.
for the community?
Correct.
Oh, no, I can't say no. When you're charged with serious felonies, we want that person to be held accountable. Did we think he was going to go out and commit felony sexual actions in between that time? We didn't believe that to be like in that moment, but you can't predict what the future could be. So again, there's two prongs to that. You want someone back in custody as soon as possible to be held accountable for their actions that they're accused of. And two, is there always potential for someone to reoffend if in fact what they are accused of is true? Absolutely. So that was why we made the decision to be aggressive with it and find him and get him back into custody. Again, there's some agencies that probably would have said, you know what, we'll come across him a different day, or someone else will. We'll lodge a warrant. When he's picked up, he's picked up. That's just not our style.
I guess, what was the original plan? When you thought he was gonna be staying there for a while, so what was the plan, like, when he was gonna get out? You know, was there communication there with the hospital? Like, I guess what was the plan? Because I imagine that you were gonna take him back in custody after he got out.
Yeah, so the plan was that he's released, the medical issues dealt with, and when it was appropriate, the court order would be changed again, and then we would take him back into custody, and he would go straight from the hospital, straight back to the jail. Obviously, that didn't work out as planned in this situation, and so if we would have got it the way we wanted it and predicted it, that's what would have happened. In this case, it changed rapidly, and by rapidly, I mean if anybody thought it was going to change within hours or a day, this decision would have been, we'll just leave deputies at the hospital, and if he's going to be released in a day or two, we'll bring him back to the jail.
Can you say how he was when you found him? Was he actively trying to avoid you guys, or was he like kind of surprised at the reaction?
I would say that he didn't want to be taken back into custody, if that's what you're asking me. No, I didn't. No, nobody probably does in general. And
I guess I'm asking if he was trying to avoid.
did he like fight us?
Was he hiding?
Is he
Was he
flight?
hiding? Was he trying to avoid being picked up?
Yeah, he was trying to avoid us picking him up, 100%. I mean, and that's common, especially when you're talking about someone who's got serious charges. You know, jail's not a fun place to be. So there was some of that. And again, also the other side of it is some medical stuff that you want also handled. So you got a conglomerate on this one that it's an interesting one again, which is why I understand you're all here and y'all have questions, and try to answer them as transparently as possible without hitting on anything HIPAA related where we'll have a problem on that side of the house either.
Is there, I know like this was like you guys were following your procedures and hospitals following their procedures. Is there a reason that like because this happened, is there gonna be like a review on like, is there a way we can better the policies or tighten them up so that this kind of thing doesn't happen again?
Yeah, it's a good question. I mean, if you talk to anybody here, I always err on the side of caution, but I also am a fiscal hawk and I look out for the taxpayer. Again, you try to make the best decision, and I own this one. This one sits with me 100%. If there will be future ones, but the decision has to be made in a similar way. If it looks like a short-term window, we spend the money. It's 24/7 around the clock at the hospital. If it looks long-term, then that's when you start making decisions of, is this person in for a month? Is this person in for 3 months? And what does that cost look like? And is there any likelihood of them being able to walk out? If the answer is a high dollar and a very low possibility of being able to walk out of the hospital on their own 2 feet, then I would make a similar decision. But again, there's the unknown. And this one is one of those ones that's the misnomer.
And as far as custody, is he in the jail? Next court appearance, where is he?
I can get you do you know his next court appearance?
I don't know his next one.
We can get you the next court appearance. Someone asked me that on the phone, and I'll get the next court appearance for you.
Will there be any additional charges after what has happened?
I don't think we had any additional charges because again, he didn't fight and resist, and you didn't have an escape. So there really wasn't any extra crime committed. It's just we wanted him back in custody after the judge changed the order for us.
And does he all of a sudden become a flight risk because of what took place here?
No, I mean, anybody in our custody, we treat them like they could be a flight risk. Any inmate, they're locked down for reasons, and those policies and procedures are already in place. No need there. But again, this one is right now the one we're talking about. But in the future, you're going to have more tough decisions to make when you have the anomalies out of the jail, which is typically around medical stuff. So it gets a little complicated.
Can you talk about it all, what it kind of looks like to be like under custody in the hospital versus not? Was there any concerns if he was going to be a danger in the hospital after being taken out of custody?
Yeah, again, that goes into the overall decision to ask the court to release or not release. In this case, I can't speak to what his exact medical condition was where I felt comfortable with the release. But you make a good point. I will talk very generically and hypothetically. If you had an inmate who had 2 broken legs and had no possibility of being able to walk, would that be severe enough? I don't know. But if you had someone in a coma, would that be severe enough to consider having a release? And the answer would be yes. So it really does depend on a case-by-case review and in consultation with our command staff members. And then again, I make the final decision. And this one, if I was making it again, knowing what we all know today, I would absolutely have left deputies at the hospital.
So there was no miscommunication on Strong's part. It sounds like you're kind of owning this as a unique scenario that ended in a more challenging way.
Yeah, I'm taking my accountability here. That's all I can tell you. I don't know what Strong's policies are on those things. You'd have to talk to them about it. That's not my window. My window is right here, and I made the decision to ask for the release, and made the decision to go search for him when he walked out.
So, is it fair to say when he was inpatient at the hospital, he was not a threat to anyone at that moment when that he was being treated? There was no one, because people watching might say, oh, well, wouldn't that be a threat to other people in the hospital? You know, but you're saying.
Do you mean when I made the initial decision?
Yes, yeah,
He was no threat.
okay, that's what I was, yeah.
Yeah, very clear. I'll be very clear on that. When I made the decision, he was 0 threat to anybody. Any other questions? And I'm sorry, I can't speak specifically to it because it answered a lot of your questions. But again, there's these protections and I get that, and I don't want to violate that for a number of reasons. All right, I'll get you all the return date. Kathy, can you find that for me, please? Before you go, and if you have anything else, let me know. All right?
And he has been returned to jail here.
Yeah, he's back in our custody,
Yeah, okay.
and he's at the hospital with deputies.
I see. Okay,
So-
so he's at Strong.
Oh, he's at the hospital.
Correct.
Oh, okay.
He's at
Been your custody.
he's where he was from think of it this way, his status is back to where it was from the 5th to the 12th. He's ordered to the custody of the sheriff, and therefore minimally a deputy is on him at all times. So you had the 12th to the 13th where that order was changed. So you had this window, again, that rapidly changed.
So no matter how long he's staying, there's gonna be a deputy there now?
Correct.
Okay.
He's in the custody of the sheriff, so ordered by the court. Think of it this way, anytime a judge orders someone in the custody of the sheriff, they are always in the care of the jail as a whole, or if they're out, under the care of a deputy sheriff. So think of shackles, however you want to think about the custody would be right there. In this case, in the hospital, it's a deputy right there by the bed.
So not shackled in the hospital?
I don't know if he's shackled. I mean, at the hospital, that's medical decision, but minimally the deputy is right there. All right, folks, appreciate it.
Thank you.
Thank you.
Thank you.
Yep, you're welcome.
Yeah, I think Cam was looking at for right now. So actually.